Welcome to Brain Explained. In today's video, we will go over top 8 signs of PTSD. Feeling scared and afraid during and after a traumatic situation is totally normal. Fear is a part of the body's fight or flight response, which helps you avoid or respond to potential danger. Essentially, you may experience a range of reactions after trauma, and while you recover from initial symptoms over time, you could continue to experience problems as a result of the same traumatic event. When this happens, you are dealing with post-traumatic stress syndrome, also called PTSD. Interestingly, PTSD has been known by many names in the past, such as shell shock during the First World War and combat fatigue after the Second World War. But PTSD does not just happen to soldiers. It can happen to anyone of any ethnicity, nationality, or culture, and at any age. From statistics, PTSD affects approximately 3.5% of U.S. adults every year, with an estimated 1 in 11 people being diagnosed with it in their lifetime. Worried whether you have PTSD? Here are 8 signs to help you find out. 1. The most common is re-experiencing symptoms. This involves relieving the traumatic event by experiencing flashbacks that come with physical symptoms such as a racing heart or sweating. Other times, you can have recurring memories or dreams related to the event and distressing thoughts. Interestingly, these symptoms are triggered by thoughts and feelings as much as words, objects, or situations that are reminders of the event can. 2. Another sign of PTSD is avoidance. This happens when you consistently avoid reminders of the traumatic event. People, places, activities, objects, and situations that could trigger the distressing memories. It can also present as trying hard to avoid remembering or thinking about the traumatic event, in which you violently resist talking about what happened or how they feel about it, or shy away from similar discussions altogether. 3. If you have PTSD, you also display some cognition and mood symptoms. You have a hard time remembering important aspects of the traumatic event, and also have negative thoughts and feelings that can lead to distorted beliefs about yourself or others, and wrong thoughts about the cause or consequences of the event, leading to wrongly blaming yourself or others, accompanied by feelings of fear, horror, anger, guilt, and shame. In PTSD, your mood will also be affected until you lose interest in activities you used to enjoy. Soon you begin feeling detached from others, and worse, will lose the ability to experience positive emotions like happiness and satisfaction. 4. Alterations in arousal and reactivity. These are some of the most common signs of PTSD. This includes being excessively irritable and having angry outbursts, behaving recklessly or in a self-destructive way, being overly watchful of your surroundings in a suspecting way, being easily startled, and having problems concentrating or sleeping. 5. In PTSD, physical symptoms are unavoidable. If you have PTSD, you'd see a good number of physical signs and effects, from sweating, shaking, headaches, dizziness, and stomach problems to aches and pains when exposed to a similar threat or when remembering the traumatic event. You could also experience a weakened immune system, which can lead to more frequent infections, and most commonly, sleep disturbances that result in tiredness and other health problems. 6. Another key sign of PTSD is intrusion. PTSD, intrusive thoughts such as repeated, involuntary memories, distressing dreams, and flashbacks of the traumatic event are not uncommon. In fact, flashbacks may be so vivid that you feel like the traumatic experience is happening again. Surprisingly, children and teenagers can also develop PTSD. Their symptoms have some similarities with those of adults, but there are some unique characteristics. Notable signs of PTSD in children include 7. New onset of bedwetting. Bedwetting is normal in younger children, but when an older child or one who has stopped bedwetting for a long time suddenly begins again, it is not normal and usually could have PTSD as the underlying condition. This is linked to the psychological processes that occur after a traumatic experience and would stop once the child is helped to get over the experience. 8. Excessive clinginess to parents or caregivers is another key sign of PTSD in children. This manifests as a form of avoidance symptom, where kids stay away from other people, and even those that are familiar with and were once friendly with. They do this in an attempt to feel safe and secure, while still conscious of the traumatic experience they went through. Now, after seeing all these, do you think you have PTSD? Well, symptoms of PTSD usually begin within 3 months of the traumatic event, but they sometimes emerge later. So for you to meet the criteria for PTSD, you must have symptoms for longer than 1 month, and the symptoms must be severe enough to interfere with aspects of your daily life, such as relationships or work. The symptoms also must be unrelated to medication, substance use, or other illness. Most importantly, to be diagnosed with PTSD, you must have all of the following for at least 1 month. At least 1 Reexperiencing symptom, at least 1 Avoidance symptom, at least 2 Arousal and Reactivity symptoms, at least 2 Cognition and Mood symptoms. Luckily, PTSD can be overcome. There are treatment options that actually work. Let's see 3 of them. The first is cognitive behavior therapy, CBT. You can also call it talk therapy because it involves discussing your problems with a trained, licensed therapist to help reframe your thoughts and mindset. This is because PTSD will make you feel like you're stuck in a permanent negative cycle. So you need techniques that are rooted in logic and reason to turn those thoughts around until they no longer control you. These CBT techniques include identifying your thoughts and feelings in certain situations, learning and practicing a healthy coping mechanism to apply in real-life scenarios, developing short-term and long-term goals for your treatment, and self-monitoring by tracking your progress outside of therapy sessions, such as journaling your thoughts, feelings, and reactions to certain situations throughout the week. Dialectical behavioral therapy, DBT, is another effective way of treating PTSD. The therapy was initially developed to treat borderline personality disorder, but has since been adapted to treat other mental health disorders as well, including PTSD. It works by simply helping people learn to better interact with their surroundings in less emotional ways. The techniques used in DBT include mindfulness technique, which helps you pay attention to what is happening in the present moment rather than reliving the past, learning to tolerate stress, regulation of emotions, and group therapy to help you process your feelings with other people who are experiencing the same things. Lastly, we'll see trauma-focused therapy as a treatment for PTSD. This method of treatment recognizes and emphasizes understanding how the traumatic experience impacts your mental, behavioral, emotional, physical, and spiritual well-being. Now the purpose of this is to offer skills and strategies to assist you in better processing emotions and memories tied to traumatic experiences, with the end goal of enabling you to create a healthier and more adaptive meaning of the event. If you've been experiencing symptoms of PTSD, you know that a solution isn't far-fetched. So, which of these treatment options would you like to try out? Let us know in the comments. Also, do like and subscribe to this channel if you haven't. See you soon!